Hi, my name is Kelly Duggan. I'm a doctor of physical therapy, the owner of Physical Therapy U in Bridgewater, and the host of the Health and Fitness Connector podcast. And I help student athletes achieve maximal recovery in the minimal amount of time from sport related injuries so that they can get back into the game and play better than ever. This is a 3-part series on how to keep your athlete and your child off the DL this season. In the first video, which is this one, we're going to talk about some red flags and some things that you should be keeping an eye out for in your athlete. In the second video, we'll talk about some of the most common athletic injuries that I see happening and what to look for so that you can catch it early. And in the third video, we will talk about some tips and tricks and things you can start doing today to reduce your risk of injury for youth athletes. So first off, I just want to start with an astounding number. 3.5 million student athletes each year end up in the emergency room with sport-related injuries. And that's really just kids ages 8 to like 14. That doesn't even include high school sports. So kind of a major number. And what's astonishing with that number is that 60% of those injuries are reported to be preventable. So that's what I'm hoping this video can help with today, is just reduce some of those injuries that are out there that were preventable injuries. So this is the first video, so what we're going to talk about today are some red flags. And when I say red flags, that means if it's something that you see is happening, you should be calling your child or your athlete's pediatrician, or if they have a trusted physical therapist, you can call them as well. A lot of private practice physical therapy clinics, mine included, offer free things like injury screenings. So if they sprain their ankle and you're not really sure if it's bad or if it's something they should stop playing, do a quick little injury screen by the physical therapist to help guide you into, nope, you're going to need an x-ray, maybe you need to go to urgent care, see a pediatrician, or maybe just, rest in ice for a couple days. So we'll talk about some of those red flags where you should be making that phone call. First off, we're going to go with the obvious ones. And, they are obvious, but all of us as parents and coaches, we get very busy and sometimes we just ignore things, but these are things that you should not ignore. And if you see it happening, it's a little trigger to definitely make that phone call. So any obvious joint deformity, so if their elbow looks funky and they're complaining of pain in their elbow, knee, ankle, hip, back, anything like that, anything that's an obvious deformity or looks kind of funky, that warrants a phone call for a professional to take a look. Don't go on Google and search, elbow dislocations. Leave it up to a professional to take a look at that and decide and kind of triage where your athlete or your student, your child should be going. In addition to an obvious deformity, another obvious red flag would be excessive bleeding. Obviously, I don't want to say it, but I feel like I have to say it. So any excessive bleeding, right? Obviously you want to get that checked out. So let's talk about some red flags related to concussion. So everybody knows about concussion. Everybody knows that we can't ignore concussions. And when they know, you should be resting and you need to get the return to play protocol going and all that. But additional phone calls, additional things that might warrant a phone call to the pediatrician would be concussion that results in any loss of memory. So either before, during, or after the event. If your child is saying, they're confused about something that happened or they don't remember it happening, that warrants a phone call to let your pediatrician know. Concussion followed by nausea and vomiting, either at the time of the concussion, even if it's 6, 8, 10 hours later, definitely an immediate phone call to the pediatrician if there is some nausea, vomiting happening. A concussion followed by any visual disturbance, so blurry vision or double vision, definitely that's an immediate phone call. A concussion followed by hearing loss or ringing in the ears, we call that tinnitus. Anything like that warrants a phone call as well. Symptoms that, this may not be a super mild concussion, or maybe it is, but it's just got some more serious symptoms going along with it. So those are concussion red flags. Definitely want to make a phone call on those. Third red flag kind of section I want to talk about would be for pain. A lot of kids get hurt in sport. We're used to getting hurt when we were young and kids, and it's just growing pains, get over it. But there are certain red flags associated with pain that you should be paying attention to. So One of those flags would be a low-grade fever with pain. So if they're complaining of back pain or both hip pain, and it's been a few days, and it's also associated with some sort of low-grade fever, 99, 100, things like that. That warrants a phone call to the doctor. We're starting to think, of things maybe with an infection and along those lines. So definitely don't ignore pain if it's associated with a low-grade fever. Obviously, excessive pain is not something that you want to ignore. That warrants an injury screening or being seen by a pediatrician. Another red flag for pain would be pain that doesn't go away. So say your child's playing basketball, they roll their ankle, it hurts, you're smart, and you say, all right, you know what, take the next 2 days off of practice, let's ice, let's rest. If you've done that and it's been 2-3 days and they're still complaining of pain, that warrants a phone call by a doctor, or again, you could do a little injury screening by a physical therapist, and they can kind of guide you with what to do next. So those would be the pain red flags. Another red flag related to pain would be if your child is waking up at night because of the pain. I don't want you to call if it happens once. That's really not that big of a deal. But if they're waking up a few nights, then definitely, if they're waking up from pain and it's been a few nights of it, that warrants a phone call, and just let your pediatrician know or your physical therapist know. So that's concussion red flags, that's obvious trauma red flags, that's pain-related red flags. Definitely phone calls warranted for those. The other thing I wanted to briefly talk about in this first video series is that why these injuries are happening and why those numbers are so high, that 3.5 million number. We all played sports when we were younger too, but we never played it to the intensity that children play nowadays. If you want to play soccer 365 days a year, you can. It's out there. You can play club sports. You can play rec sports. The intensity that kids are playing today is at a much higher level than what we ever played. And the concern with that being that a lot of times it is the same sport year round, whereas, again, when we were kids, it was kind of like you played one sport in the winter, you played one sport in the summer, maybe something different in the fall, but it wasn't typically the same sport year round. So what's happening is we're getting all these overuse injuries because our athletes aren't able to rest like we were able to do years ago. We'll talk about that a lot more in the second video and what some of those overuse injuries look like and what to look for. But just, wanted to make sure that I got the idea out there that, it's really good to mix up your sports, whether you take one season off and play a different sport, or maybe you just take a couple weeks off in the winter, a couple weeks off in the summer. But playing year-round without giving your body a real break can create some of these overuse injuries, and it's why those injuries are so high in our youth athletes today. Thank you for listening in on this first video in a 3-part series, how to decrease your athlete's risk of ending up on the DL. I hope to see you for the next 2 videos. Thanks.